Welcome. My name is Dr. Tartaglia. I'm a cognitive neurologist and part of the Canadian Concussion Centre. And I'd like to welcome you all to the Canadian Concussion Centre's webinar series that is sponsored by the Laborers International Union of North America, LIUNA. I'm pleased to be moderating our webinar series developed for individuals that have suffered a concussion, their caregivers, as well as the healthcare providers. The sessions recur every other week, live on Tuesday evenings from 6 to 7 p.m. EST. The sessions are recorded and available for subsequent viewing on the CCC website. The sessions focus on various aspects of concussion and include an expert speaker presentation for the first half of the session, followed by a question and answer period for the duration. We'd like to ask that you put your questions in the question and answer section that you can see at the bottom of the screen. You should see the question and answer icon on the bottom right of your screen in the Zoom webinar application. Once pressed, a window will open to submit your question. If you have technical questions, please enter those in the chat section. So before proceeding, I'd like to acknowledge the Indigenous peoples of all the lands that we are on today. Even as we meet virtually, it's important to recognize the lands we each call home and reaffirm our commitment to improving relationships and understanding with local Indigenous peoples. From coast to coast, we honor the ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. So, for this weekend's session, it gives me great pleasure to introduce Dr. Lesley Ruttan, that you probably all recognize as the moderator. She's a registered psychologist practicing in the areas of clinical neuropsychology and clinical psychology. She has been a staff neuropsychologist at Toronto Rehab University Health Network since 2002, and working in inpatient and outpatient areas with a wide range of acquired brain injuries. She's been working with the Canadian Concussion Centre since 2014, assisting in the development and delivery of concussion education and support workshops, and now in the current webinar series. She serves as the hub member for ECHO Concussion at UHN and consults with the Hull Ellis Concussion Clinic at Toronto Rehab. She served as practice leader for psychology at Toronto Rehab for many years and has been actively involved in the training of clinical residents and practicum students. She also maintains a private practice, providing neuropsychological and psychological assessment and treatment. And it gives me great pleasure to introduce her to present on strategies for improving mental health.
Great. Thank you so much, Dr. Tartaglia. Let me just share my screen. And we will start at the beginning. Okay, I'm hoping that everyone can see that. Okay, all right, so here we go. So let me just move on. So I'm going to tonight be talking about mental health and more from the non-pharmacological perspective. We've heard other mental health talks. We've had the pleasure of having Dr. Abe Snyderman with us, who is a neuropsychiatrist and has presented some non-pharmacological, but also pharmacological as well. So those talks you can reference for that information. So tonight, I'm going to provide a little bit of background in terms of concussion, the types of difficulties that often follow, and also talk about the cycle of prolonged symptoms. After that, I'm going to move into how do we manage mental health and the various types of strategies we use. And, you know, there's a fair bit of information in tonight's webinar. There could be even more, but what I'd really like you to take away today is hopefully understand why mental health symptoms happen in the first place, why they persist, and what actually helps. So if you've been attending our webinar series, it won't be a huge surprise, and you may have seen this statistic before, but it's estimated that there are about 150,000 new concussions in Ontario per year. And what we know is that the good majority of individuals that have a concussion experience a pretty, full recovery, often within weeks to months. But there is this smaller proportion, the numbers range, but approximately 15 to 20% of individuals who go on to struggle with more prolonged or persistent symptoms. So when we're talking about 150,000, that means, anywhere from 22 to 30,000 people in Ontario are dealing with persisting symptoms. So this is a significant issue. After concussion, I mean, there are acute symptoms, there are prolonged symptoms. I'm not going to read through this slide, but it just gives you a sense of the range of symptoms that can occur after a concussion, crossing the physical domain, the emotional behavioral domain, as well as the cognitive domains. Um, Now, some of these are more common in the acute initial period, but many of these also will occur um, in the more prolonged phase. And certainly tonight, I'm probably most of the time talking about more prolonged and persistent symptoms because that's really when the mental health issues can become problematic. So we know that mental health difficulties are really common, and they actually appear to be major determinants of post concussion wellness and how people recover from a functional perspective. And when I say that, just getting back to normal life, getting back to work, getting back to school. And it's estimated that about 1 in 5 individuals may experience mental health symptoms up to 6 months after a mild traumatic brain injury, which is another term for concussion. You see them used interchangeably. The really important thing is we want to monitor, screen, and intervene early because we know that by doing so, we can really improve the recovery trajectory for people. Now, I put this slide up not to alarm people, but there is research to suggest that traumatic brain injury, concussion, as well as more significant severe traumatic brain injury, increases the risk of suicide. So this just, emphasizes that it's really important for us to have early detection, to have treatment for those mental health difficulties. And we know that as well, social support, all of those things can substantially reduce the risks. So, in terms of the causes of mental health difficulties after concussion, well, number one, we know that the brain controls everything that we do, including our mental health, our emotions, our personality, our behavior. But we believe that there's likely, not one cause in terms of mental health difficulties after concussion, but probably several interacting factors. There is evidence to suggest that there are physiological brain changes that can occur. In particular, some research suggesting that there's a dysregulation of the cerebral blood flow and that there's an actual mismatch between what our brain is needing metabolically and the delivery of that. We also know that the autonomic nervous system can become dysregulated. So, this is the nervous system that controls a lot of our involuntary functions. And just in simple terms, what can get happen is almost like the nervous system gets stuck on high alert and people are just walking around on that high alert. It's like that internal alarm system is always ready to go off. And that too can drive mood, sleep, as well as pain symptoms. We also know that there's an overlap between symptoms. So the impact of things like pain, poor sleep, cognitive problems, fatigue can feed back on other symptoms and exacerbate those. Often if we're dealing with pain we're not feeling as well from an emotional perspective. If we're not doing well from a cognitive perspective and we're trying to go back to work, that can cause a lot of mental distress. And then finally, under the other issues, there's a whole host of factors that I see that have a really significant impact on people. And some of these relate to, maybe the nature of the injury. For example, someone that's been involved in a motor vehicle accident and has medical legal things going on, or they're dealing with WSIB, or they're getting letters from their insurer. All of those undoubtedly are, cause significant stress for people. It can be very triggering, unfortunately. And I often see people being set back as a result of those things. Concussion and post-concussion symptoms, we often talk about being invisible, and because it's not something that you necessarily can see. And so even sometimes people that are close to the individual that's had the concussion, um, may see the person not functioning as they did, and they don't understand why, because they feel like, well, you look good, like what's the problem? And then just functional decline. So if people aren't able to get back to doing the things that they were doing, whether it was playing a sport, returning to school, socializing, all of those too can contribute to mental health difficulties. So something that we always like to speak about with both healthcare providers and individuals that have had a concussion is this cycle of prolonged symptoms. And basically here, if someone's had a concussion, which is a brain injury, you can see the physical symptoms, the cognitive symptoms, and emotional symptoms. And what we know is that disorders of mood can actually exacerbate those symptoms. So, for example, if someone is having, as I said, they're struggling to remember things, they're having cognitive difficulties, and then as a result of that, they're failing their exams at school. Not surprisingly, that would have an emotional impact. They may start to feel down. They may be anxious. Those things in turn can contribute to physical symptoms. So it's not unusual, especially as time wears on and symptoms become more sort of longer in duration, that we can sometimes see people getting stuck. So it can be really helpful to sort of look at the symptoms in that framework. And it's not to say that we have to fix everything at once, but sometimes just intervening at one place or node within this cycle can sort of start things moving in a more positive direction. So, in terms of managing mental health, everyone has access to these. There's something called the Living Guidelines, which you can access online. And just so you know, because some of the material tonight I'll go over quickly, I have included references at the end of the presentation with all of this in it that you'll be able to access, and copies of the slides will go up on the website, so you'll be able to refer back to these. But this is basically just showing you the sort of an excerpt from the Living Guidelines, which are a great resource. There are guidelines for healthcare providers, but there's also a patient guideline as well. And you can see here the non-pharmacological treatment of mental health disorders. That's what I'm focusing on tonight. And some of the information that's included here is taken from that. So we know that psychological intervention, so this is the non-pharmacological or non-medication interventions, are important in treating mental health difficulties. Um, these can include things like talk therapy. Tonight, I'm going to be talking about cognitive behavioral therapy, but that's not to say that there aren't other types of talk therapy that can be helpful. But I would say CBT is one of the more well researched in with brain injury as well. And there is a lot of scientific support for the use of CBT across actually multiple health conditions, including concussion. It's not to say that everyone needs a specialist in terms of their mental health treatment, but certainly I think we can say that everyone benefits from monitoring and early support. And we always want to flag individuals early if it looks like they're not progressing as we would hope, and to get them help earlier to sort of prevent that cycle of prolonged symptoms. Now, In terms of managing mental health, there are some basic things, and these are things, that we all should do in terms of our own self-care. Um, but I would just emphasize that these aren't just, they can sound, you know, very simple, but they're actually really potent, especially when they're not working right. So especially I'm looking at the sleep right now, is a big one, for example. But these are actually all biologically active recovery tools. And I'm going to go into some of them in more depth. But these are things like sleep, nutrition, physical exercise, alcohol and recreational drugs. We typically recommend that people avoid that when they're recovering. Energy conservation. So after concussion, it takes the brain longer often to do the same tasks it did before. So people are often finding that, their reserve is low. They're not able to do the same amount in the same period of time. Social activities and recreation also important. That ability to connect with people, and having some daily routine and structure is something that I included there as well. This is, I think, especially important when people may not be working, or they've had to cease work, or not able to return to classes at school. And I see it as a real risk factor for depression and potentially other mental health issues when people, sort of don't have a plan for their day. So, in terms of sleep, research indicates that if we have chronically poor sleep, or insomnia, it can actually contribute to the development of depression, anxiety, irritability. I think we've all had nights of bad sleep and can attest to this. Um, but interestingly, it goes the other way around. So we also know that, if someone is depressed, for example, sleep change or sleep difficulties is actually a symptom of depression. So you can really see how these symptoms interact. In addition, there's something called the glymphatic system, which is something that's a little bit more recently discovered, and it's really interesting because it's seen to work mostly when we're sleeping. And basically, what it's doing is it's almost like there's a cleaning service going on in the brain when we sleep, and it works to clear waste from the brain. So, if we're not getting quality restorative sleep, it's not able to work as it should. So, we know that screening and treating insomnia can reduce symptoms of depression, anxiety, and stress. And it really is one of those, it's what we would say a high yield intervention point in that cycle. So we know that if we can improve sleep, often we will see accompanying improvements in mood, pain, and cognition. I've also just noted here, because on a number of these topics, we actually have other experts who have done a deeper dive. So Dr. Neil Parekh, for example, uh, has done sleep talks for us. So you can actually access those if you're having sleep difficulties and you want to hear more about recommendations around sleep. You can go to his webinar. Another one is nutrition, and I'm not going to say a whole lot about this. We know that good nutrition supports recovery. It's not a standalone treatment. There is a lot of, work, I think, being done. There are a lot of claims being made. We always warn people, if you're seeing someone claiming to have a cure, take this pill, take this supplement. Again, if there really was, we would certainly let you know. So this is, good nutrition absolutely can support recovery. I have included here a link. Baycrest Hospital in Toronto has put together an evidence-based brain health food guide, which it's about 2 or 3 pages. It's quite easy. It's something you could print off and stick on the fridge. And and certainly is, would be a helpful thing to follow if you've had a concussion, or even if you haven't had a concussion, just in terms of maintaining good brain health as we age. Physical exercise. So again, Dr. Mark Bailey was with us not too long ago, and he talked about exercise therapy for concussions. So, while there's not a magic bullet, I would say physical exercise is one of those. It's approaching. It can definitely be really, really helpful. We know that when we exercise, something called BDNF is released in the brain, and it helps the survival and growth of new neurons and synapses. We know that there's a positive effect on mood, on stress, even on our thinking abilities. So we really, and this is why people are really encouraged to start resuming activities. We don't want people sedentary, not to say they're jumping back quickly, but that they are gradually increasing their exercise levels. So again, if you want to hear more about that, Dr. Bailey's talk was not too long ago, and it, again, is on the Canadian Concussion Center website. Pacing, I put this up here. This is an app that anyone can access. It was developed in London, Ontario, and it's just an example of how pacing can be operationalized. It was actually co-designed by acquired brain injury patients and their caregivers. Again, helping people pace. And what I mean by that is, and it's often a bit of trial and error initially. People will sometimes overdo it. And then, I had a patient yesterday say, I go to the gym and then I was in bed for 2 days. So that's clearly, clearly she didn't pace herself. She had done too much. We don't want to see that. We want to see people sort of just going at a gradual rate. The other thing in terms of mental health that's important, and whenever I'm seeing people and they're coming in and they're depressed, I always suggest that they talk to their primary healthcare provider just about getting some basic blood work, making sure that their thyroid function is intact, looking at vitamin B12, their iron, hormonal changes, for women. Because again, when any of those things may be off, you can see changes in mood. You can see changes, other symptoms that may mimic post-concussion symptoms. Okay, so the next thing I wanted to chat about is cognitive behavioral therapy. So if you haven't heard about this, it's basically a type of talk therapy. There are many different types of talk therapy, but it tends to be quite goal oriented. It's generally fairly short term, and the idea is to teach individuals strategies and skills and sort of deal with here and now problems. And the idea is that there's this collaborative effort between the therapist and the client. Dr. Snyderman had mentioned this book. It's sort of the Bible of the CBT Bible, Mind Over Mood. It's something that you can purchase anywhere. And I've just pulled this, what they call the 5-factor model. And it's sort of similar to, that vicious cycle that we talked about with concussion. And this, basically what the big oval is meant to reflect is our environment. And when we say environment, that's our life, what's happening in our life, what's happened in our life, it could be positive things, negative things that have been stressful. And then within that big oval, we have our thoughts, and we have thousands and thousands and thousands of thoughts that just, randomly pop into our head over the course of the day. We have our moods, that is, how do we feel emotionally? We have our behaviors. Our behaviors are what we do or what we don't do. And then our physical reactions. So, like, what's happening in my body? And the most important piece, if there's one thing that I just want you to remember from this diagram, are the arrows. Basically, all of these things are interconnected. What does that mean? Well, it means, you can have a thought in your head, and that thought can cause an immediate, depending on what it is, an immediate physical reaction. It can cause your heart to start racing. It can cause a release of cortisol if something dangerous, or what you perceive as dangerous, is happening. It can cause you to feel, a negative mood. So again, this is something that I will use with patients to sort of get a sense of what's happening for them. What are the potential thoughts that may be impacting on those negative moods. CBT is basically, the idea is that, there are times when we have thinking that is really quite unhelpful. It's that inner voice that probably most of us have experienced. Sometimes we have learned patterns of unhelpful behavior, and we can get stuck. We can get stuck in loops. So, for example, if I've had a concussion and then a year out, I'm still having headaches. Well, every time I have a headache, I may have a thought, oh my God, I can't believe I'm having this headache at a year after my concussion. It's not supposed to be like this. And then maybe I avoid, going for a walk or going to exercise or going to see a friend. And that leads to more symptoms. So you can see how, again, we can get into these negative cycles. So, in terms of how it evokes change, CBT, it really encourages us to start paying attention to our thinking, questioning our thoughts, identifying, are there any cognitive distortions or errors? Or is there any part of my thinking that perhaps isn't entirely valid? Are there any more balanced perspectives or alternatives that I can come up with? And just starting to challenge, we tend to just automatically believe everything we think, and it's not always true. And then testing out alternatives in the real world, so actually doing experiments. Just to say, CBT, it's not about telling yourself you're making this up or it's all in your head. Not at all. It helps the brain recover by changing patterns that may be keeping those symptoms going. The other thing that I wanted to talk a little bit about is mindfulness. So this is sometimes, you know, I suspect some of you out there have probably participated in groups or heard about mindfulness. And it's been defined as the awareness that emerges from paying attention to something in a particular way, on purpose, in the present moment, and not in a judgmental way. A lot of people, when we talk about meditation, think it's about sort of shutting down everything that's happening in your mind, and you can, just being able to sit back and go blank. And that's not really it at all. It's a skill, and it's about training our attention, and then in the context of concussion, changing our relationship to symptoms. And I'm just going to start speeding because I'm just aware of the time, but studies have shown benefits for reducing stress, anxiety, depression, pain, fatigue, sleep, even cognition as well. So again, it's not it's a skill. It's not a personality trait. A lot of people always say, "Oh, I'm not the type of person that can do this," and it's anyone can, and even just trying to start with little short practices can be helpful. Neuroplasticity is a term that basically just suggests that the brain can change. It can change its structure, it can change its function. We used to think that this wasn't possible. Norman Deutsch has written a book, which some of you may have read, and mindfulness, engaging in regular mindfulness, studies have actually shown that we can change our brain in positive ways. And I'm going to skip some of these slides. Again, some of these are more resource-based. These are different types of groups that are out there. This is also just, again, for your interest. This is a story of traumatic brain injury, but with the use of how mindfulness was really transforming for this individual, Kevin Pierce. He was a professional snowboarder he didn't sustain a concussion. I should clarify that. He had a very severe traumatic brain injury, and was in a coma for an extended period of time. But he had made a remarkable recovery. He actually spoke at several years ago at a traumatic brain injury conference at Toronto Rehab, where I work, and it was incredible to see him up there speaking after having watched a documentary on him called The Crash Reel, and seeing what he went through. He's also started an organization called Love Your Brain, which is very much focused on yoga and meditation for individuals with brain injury. Another thing to consider is peer support. So we know that having support from others that have experienced something similar can be very helpful. Um, Good support groups should offer a place where you can ask questions, you can tell your story, you can learn, share coping strategies, what's worked, what hasn't worked. I would say, ideally you want to avoid groups that are negative, that are stuck on what is wrong and are lacking in sort of a direction forward. If a group makes you feel worse after attending, pay attention to that. Don't go back. And not every group fits every person. It's okay to keep looking. So, in summary, there's no magic formula. When it comes to prolonged concussive, post-concussive symptoms and the mental health aspects as well, healthy habits and really addressing those various aspects of self-care go a long way. So it's often the treatment is multi-pronged. It's not just one thing. We always are looking to take a symptom-based approach. So, and we want to prioritize symptoms that are likely to have the biggest impact. Those things being things like sleep, the mental health, mood, and pain as well. You want to be aware of vicious cycles, and know that effective treatments and strategies are out there, and really just sometimes it takes some trial and error, determining what works for you, but starting small and watching that your expectations are not too high, because often when we do that, it's easy to get frustrated and just give up. I think it's also important to remember that recovery after concussion is rarely just linear. There are often, bumps in the road, and to accept that that's also part of the process. So I'm just going to just a couple more things I wanted to say. So there are a number of resources that I've included. I'm just again, you're going to have access to these. Um, so there are you can access all of our webinars on the website. I've listed different resources for CBT, for mindfulness, for brain injury and concussion more generally. And then finally, I just wanted to let you know about a resource at Toronto Rehab, um, that is called the Kite Tele. It's actually the Tele Rehab Center for acquired brain injury, and we offer groups for individuals. Currently, we have CBT groups, goal management therapy groups, as well as mindfulness skills training, and then there's also a concussion education and symptom management group. So I've put the link on there. You do require referral. If you go to their website, you'll see that there is a referral form that your family doctor can fill out and submit. But it's just another resource that that anyone in Ontario has access to. I should clarify that we're only able to offer to people in Ontario at this point. I know there may be people on that are outside of there. And that is the end. So I will stop sharing.
Hello. So thank you for a very informative webinar. I will start with some questions. First question is, since dealing with insurance is so stressful, I'm surprised they don't adapt it for those with brain injuries to take away all of those addition hardships that come with increase. Do you think anything can be done?
That's such a great question, because it can be very frustrating, I think, for healthcare providers as well. I've been working with people who are making progress, and then receive a letter or, something that just sets them off. It's, I think a big part of this is education. And Dr. Tartaglia, you may be able to comment further on this. I do recall um, the Canadian Concussion Center had a conference that was for lawyers, and I think there were insurers there as well. And I know I was at one. I can't recall if there was another one, but I see that as being certainly one way that we can, help to educate, I think adjusters and yeah.
Yeah. Yeah, you're right. We did actually organize a few of them to be able to instruct because there's a lot of misinformation, unfortunately, about, like even what you were talking about, mental health, and that can be a repercussion of concussion. It's actually a misunderstanding amongst lawyers, judges, insurers, but as well amongst patients. And so, really not understanding that, the way somebody acts could be a consequence of their brain injury, and that can interfere with their ability to answer questions in a certain way, really
Hmm.
um, needs more attention. So
Hmm.
yeah, it is a great question that you
Yeah.
asked there.
Yeah, it is. And I think, there's still, so efforts are being made, but I think there's still a long way to go on that front.
Yeah. Another question, how would you go easier on yourself for your symptoms such as losing items, expensive glasses, or other important items?
Mm. And the question was, how would you go easier on yourself?
Yeah, I
Yeah.
guess,
Yeah.
yeah.
Yeah. That's a good question. I don't know if there's, an easy answer to that. I mean, I think the first thing for individuals that are having cognitive difficulties is, potentially working with someone like an occupational therapist
Mm,
to come up with strategies so that maybe, you're losing those things less often. Um, I think is definitely a place to start. If there are patterns of where are my keys, where just getting more consistent and coming up with some cognitive strategies can be helpful. But in terms of going easier on yourself, uh, it's difficult. I was running a group yesterday, and there was a young woman who, you know, um, has been dealing with prolonged symptoms, and just had a very. She was actually the one, that went to the gym, and really overdid it to the point that she couldn't get out of bed for 2 days,
mm,
and but then has this idea, if I don't do this at the gym, like what's the point? It's not it's not worth it. It's so maybe they so it's sort of um when I'm working with people, I probably incorporate other aspects, other types of talk therapy. There's something called acceptance and commitment therapy, being a little bit more accepting of sort of where we're at right now, as opposed to it's difficult, it's challenging. People, we always tend to compare ourselves to where we were before the injury, before the concussion, and sort of acknowledging that you've been through something difficult, you've been through something significant, and that it's going to take some time. We don't expect that you're just going to wake up one day and be right back um, where you were. It definitely is a process, and you need to give yourself time for that.
yeah. Um, Next question. I know it varies, but what is the range for post-concussion recovery that you've seen?
The range of recovery, well, I mean, I think different studies show there's a fairly significant variation. We know, I would say that generally speaking, you know, 80% or so of people do make a relatively rapid recovery, but there is this smaller proportion of individuals that do not. And, there's been a lot of work and a lot of studies trying to figure out who are those people? Why are they not recovering? And there's a lot of different um, factors that have been suggested. For example, we know one thing is, that isn't within our control is being female. So females are more vulnerable to persisting symptoms. We know that if people had pre-existing migraine headaches, pre-existing psychiatric or psychological issues, anxiety issues, again, they're more vulnerable. Um, so, I'm hoping that I'm answering the question, but again, I think in my slides, I said about 15 to 20%. Sometimes you see like 10 to 30%. It's sort of in that range in terms of people that are struggling with more persistent symptoms.
Um, thank you. Someone is asking, how does one refer to the Hull Ellis Concussion Clinic or the Kite Tele Rehab Center?
Yeah. So the Hull Ellis Concussion Clinic is located at Toronto Rehab. So the only way that people get into that is if you've had a concussion in the Toronto area and you end up in the ER. If you end up at one of the emergency departments, I've lost track of how many hospitals are participating. The Hull Ellis Concussion Clinic, it's a research clinic as well as offering clinical care, but it is limited to individuals who have been seen in the ER, and then they actually have to be referred from the emergency room and seen within a week um, to go there. Now, the teleneuro rehab, which is also at Toronto Rehab and is virtual in groups, they're in the link in my presentation. You just have to go to their webpage and get a referral, and you can get into, apply to get into one of the group programs. People qualify once they are 6 months post injury for that one.
Right. Okay. Um, Somebody's asking, what actually happens physically during concussion that makes us more likely to have negative brain changes?
Mm. That's a good question. Dr. Tartaglia may be better at responding to that.
Yeah. Well,
We know there's like a whole host of
exactly.
neurochemical reactions that occur, and there seems to be, as I said, in terms of the cerebral blood flow, like a mismatch between what is needed and what is there. Do you want to add to that?
Yeah, no, I think like you said, there's a lot of things that happen. There's very limited information in terms of um, how to detect exactly what has happened. If you read 10 different studies, you see 10 different things happening. Um, but we do know that there is something that happens in the brain, right? That's why you have the symptoms that you have. And that's why I think it's really important to remember that. It doesn't mean that it causes permanent damage, right? Like, even when you get a
Mhm.
cold, sometimes people feel like their brains aren't functioning well, or, people who suffer from migraines, of course it has an impact on the brain. Doesn't mean it's permanent, but there is a brain change that happens. The lucky thing is that most of it gets better. But for some people, there might be some vulnerability to having more persisting symptoms. But that's why, as you mentioned, it is really important to treat those symptoms that come about after a concussion because they have a huge impact on your cognitive ability, on your ability to get back to your life. And sometimes there's a disconnect. People are worried that if they treat the headache or they treat the sleep or they treat the mood, they're masking some kind of brain change. But actually, that's completely incorrect. That's the whole point. You have to treat that so that the brain can get back to doing what it's supposed to be doing, which is all the things you talked about. Yeah.
Yeah, yeah, absolutely.
Um, so another question. Well, somebody's thanking you for those efforts with regards to insurance. Um, Somebody's asking about the usefulness of CBT for insomnia post-concussion and the role of medications, nutraceuticals when a patient requires this assistance, given the importance of sleep in recovery.
Hmm. Yeah, CBT for insomnia has been shown to be really effective, and I think it absolutely is worth a try. It's adapting cognitive behavioral therapy, which is what I was talking about, with additional recommendations around sleep and sleep patterns and sleep routine. So I think absolutely, I think it's worth a try. And it if as far as nutraceuticals and medications, I mean, it, the medication's not my area of expertise. Certainly, sometimes if people are not sleeping at all, it's important that they, get some help to sleep. And I do believe that there are some, um, as far as the nutraceuticals in terms of supplements, things like magnesium and things like that that I, hear are sometimes recommended. But do you want to comment, Carmela, on sleep medication?
Yeah, there are some new medications there that now that are really target orexin, the sleep neurotransmitter, which may be a good option for some people. I think we're all different. Different things work. One important message, I guess, is that people should be staying away from benzodiazepine
Mm,
medications. So those are like lorazepam. Those kinds of medications are not good for the brain. Unfortunately, they have been used a lot and sometimes for sleep. I think some people are using cannabis, which again, there are more and more studies showing that there are detrimental effects of long-standing use of cannabis. So people should be worried, should not be using that for sleep. So yeah, you should discuss with your doctors because there are different options available
hmm
for sleep. It is, as you've said, very important to get a
hmm
good night's sleep.
hmm
We know that in neurodegenerative disease, sleeping is when you actually clear your brain of some of these, like buildups. So it actually is really important to get a good night's sleep.
Yeah, yeah,
Uh,
really key.
somebody's so somebody's saying, I'm seeing a psychologist over a year and a half now, but they're not specialized in TBI. So each time they have to explain their difficulties and limitations. Each session, I have to remind about my cognitive challenges, sensitivities. Not to blame them, but what should I do? Any suggestions?
Mm, okay. Um, yeah, I think typically when I'm recommending if someone's had a concussion or severe TBI, I think it is very important to have someone that has some experience with concussion, with TBI. Ideally, someone who is a neuropsychologist but also practices in clinical psychology can be ideal because they sort of, bridge both of those things and would better understand, I think, what you're dealing with. It would be pretty difficult if you're having to remind the uh, the clinician, um, because when we're working with someone with a brain injury, we adapt to try and accommodate if the person has memory issues or attention issues or whatever it might be to make it as effective as possible. So you might want to consider that.
Somebody's asking, how do you know if you need CBT? What if you know you likely did at the early stages, but are doing a lot better with anxiety, depression now?
Mm. Yeah, I mean, I think if you're doing now, as I said in the presentation, not everyone needs to go and see a psychologist or therapist. I think it really depends on how you're feeling and how you're doing and how you're functioning. If you're, it's anyone can go out and purchase the Mind Over Mood book, and it's something that you could work on even on your own. Um, Obviously, for individuals that are really struggling from a mental health perspective, they rarely would do that. But I think if that's
something that you could try. But I would say if you're functioning well and you're not feeling, um, you feel like you're doing pretty well from a mental health perspective, I don't think you need anyone.
Um, somebody, oops, uh, actually, somebody was asking, I guess it was back to the question of the range.
Mm.
What's in terms of years, how many years for recovery from post-concussion symptoms? Have
Oh
you,
my gosh.
yeah.
Yeah, that's a tough one. Hmm. I mean, I can't really answer that. I've certainly, I've certainly see people who, have had concussions years ago and are, still struggling. This, again, is where it becomes very important to try and, really, for me, if I'm seeing someone, to gather a really comprehensive history to understand, you know, all of those pieces from those things I showed in terms of what's happening environment wise, what's happening, yeah, stressors, and other things outside of the concussion. Because again, as we move further out, it becomes more likely that there may be some sort of vicious cycle going on, or there may be other factors that are contributing to symptoms. Um, I don't know, Carmela, I know, did Dr. Tatter, was there a study looking at number
No,
of years?
we found that most people had recovered before 3 years.
Okay.
I have seen somebody recover after 10 years. It really depends because sometimes we see people who are years out and have not actually received any treatment. They don't have anything for their mental health issues. They have nothing for their headaches. They have nothing for their poor sleep. So, of course, that would be like leaving a fracture un, untended to. So I think we have to differentiate whether
Mm,
people have really remained resistant and they tried everything and really are resistant to the treatments versus we're unfortunately still seeing many people who are not actually being treated for their symptoms.
mhm. Yeah.
Um, one person is asking, is there a correlation between concussion injuries and other diseases or neurological conditions later in life, such as dementia?
Mm, mhm. Yeah. Again, another one that Dr. Tartaglia can speak to better than I. Um, yes, there is a correlation, but I don't think we can't say that just because you've had a concussion, you're necessarily going to develop dementia. Um,
Yeah.
we know that it's a risk factor, along with a whole host. If you've ever seen Dr. Tartaglia's presentations, where she's actually shown, I think it's now 14 different risk factors, including things like alcohol consumption, untreated hearing difficulties, and concussion is just one of those factors that yes can increase our risk of dementia.
I always tell people you can't change what has happened to you, if you fell and you hit your head, but you can definitely change the other factors that we know also impact your risk of dementia. It's almost hard to believe that somebody can go through a whole lifetime without having concussion because when you think of when
Mm,
you're a child and you fall, you can't explain to anybody that you've been concussed. Maybe you're grumpy for a few days, maybe you don't act your usual self. Nobody's even going to notice.
mhm,
So, it's not like Dr. Ruttan has said, it's not one to one. Um, and so, there's a lot of room to be proactive about our brain health so that we can mitigate that risk that happened because we got that concussion. And we should never forget that.
yeah, yeah.
Somebody's in the other questions say somebody says I've had many concussions, especially a few in the last 2 years, also included ear infection, um, some issues with vision, balance, and they've noticed a decline in their mental health and self-care of sleep has worsened. having difficulties pulling myself out of these frustrating setbacks psychologically and basic and physically. I guess, do you have any, what can they do to start improving?
Yeah, yeah. And that's, I think, just even hearing that, it sounds very overwhelming. I can imagine that you feel very overwhelmed with those difficulties. And I'm actually just seeing someone else who had asked, when you have multiple symptoms, it's hard to know which one to treat. And so sort of along the same lines. And yeah, you don't have to treat all of them at the same time. What we typically want to do is to, the ones that we usually prioritize are, so if you're having headaches, you want to see someone for those headaches. You want to get treatment for those headaches because we all know when, we're walking around with a headache, it's very difficult to function. Um, Sleep, as we've talked about over and over again. If you're not sleeping, talk to your doctor about it. See what can be done in terms of your sleep. And then also from the mood. So from a mental health perspective. So, I would say in a situation like this, it could, it I think would be helpful to see a mental health professional that could actually help you to sort of organize this, if you will, in terms of, okay, where do I start? Sometimes when people feel so overwhelmed, they just freeze and, it's like it, they just can't do anything at all. And which, of course, just contributes to them feeling even worse. So, I think in terms of the symptoms to address first, those three are, I would say, are big ones because they have the potential to be contributing to other symptoms that you might be having as well.
Yeah. Um, Thank you again. There's, still questions as we near the end. But, I want to remind people that these sessions are recorded and housed on the CCC website, and they are available for viewing at any time should you wish to recommend to anyone you know. We'll also be forwarding a short survey to you by email to obtain feedback on the session. And your thoughts and input would be most appreciated if you have a few minutes to spare. Um, this is actually our last session before the summer break. Our scheduled patient panel for May has been canceled, and instead you'll be able to see a patient panel at the upcoming Canadian Concussion Centre Public Forum on Wednesday, June 3rd. This is a free event. Registration is required, and you'll see here how to register. And you'll have the pleasure of hearing from a few patients as well as all these speakers who are going to talk about concussion and treatment of prolonged symptoms. So there may be some answers to some of these questions that we didn't get to. And we hope you will have a great summer, and we'll see you again in September. Thank you very
Great.
much
Thanks
for
so
coming,
much.
and thank you, Dr. Ruttan. I see people asking about dreams, and so I
Oh,
don't know if Dr. Rakan wants to answer some of the questions, but otherwise, thank you very much, everybody, for coming.
yeah, thank you. And hopefully we'll see you at the forum.
Yes, thank you.
Okay, take care. Bye-bye.